Hello, everybody, and welcome back to the podcast. I am Megan, your thriving NP, and today's guest is a very special guest and very close friend of mine. Her name is Colleen Puglisi. She is a family nurse practitioner. She is board certified by ANCC, and she's currently working as an FNP in postpartum. So she's doing postpartum rounds in the hospital. And Colleen's here today to share all about her nursing experience. She has well over 12 years of experience in the field of nursing. And in particular, we're going to chat about how to become a postpartum NP, the ins and outs of the job, and also chatting a bit about how to prepare for an interview as you're transitioning from that RN role into that NP role, and some tips and tricks that she has when we are preparing to interview. So thanks so much for joining us, Colleen.
Yeah, thanks for having me. I'm excited.
Yay. So for Colleen and I went to nursing school together, actually undergrad. And so we've been kind of in it through the last 12 years together. And Colleen has had some pretty extraordinary experience, both as an RN and as an NP. So we're excited to chat today. So Colleen, I just wanted to bring up and ask, what got you into the field of nursing? Did you always want to be a nurse, or did you kind of like fall into the field?
Yeah, I've pretty much always wanted to be a nurse. My mom was a nurse, my grandmother was a nurse, so I was just very familiar with the field. I thought about teaching, being a teacher for a little bit, but I ultimately decided nursing, and I think the two overlap because there is a lot of teaching involved in nursing. So I'm definitely glad I chose this, and yeah, I've had a great career so far.
Wow. I actually forgot that your grandma was a nurse. I didn't know that.
Yeah, yeah,
But is your
yeah,
mom's mom she was the nurse?
yes,
Okay, great.
yeah,
Well,
yeah.
awesome.
Yeah.
Um, can you talk a little bit about your transition as an RN, like what kind of experience you had as an RN, maybe kind of some of the floors you worked on, and kind of your nursing journey before you decided to go back to NP school?
Yeah, so I started off in med surge. I knew I wanted to eventually do labor and delivery, so I wanted a good background. I did a year of that. I wasn't too fond of med surge, but it was a great experience and I learned a lot. And then I switched to labor and delivery. I did that for about 5 years inpatient at some two high risk hospitals. And then when I was in grad school, I switched to a pediatric and adolescent primary care office just to gain some experience while I was in grad school in the outpatient world and make sure I wanted to stay outpatient. Yeah, so it was great. I was doing that while I was going to school.
Yeah, you've done a lot, and as like med surge to L&D to peds, I'm just curious, what was your favorite out of everything? Did you have a favorite? Do you have a favorite?
Um, I do. I feel like I like women's health and pediatrics equally. Labor and delivery really gave me great experience for my current job, but I've always really liked the two, and I think that's why I chose family nurse practitioner instead of women's because I wasn't too sure if I definitely want to go women's health because I do really like pediatrics.
And Colleen, I know that you, just from knowing you, that you've had experience in both like major cities level and trauma centers, and then you've also worked in very rural settings. Like you worked in Martha's Vineyard for like a year or two. I'm just kind of curious, can you chat a little bit about how your experience was different in a very much smaller hospital, rural setting with limited resources versus your experience kind of in these major cities?
Yeah, it was definitely different. I went from Washington, D.C., doing med surge to Martha's Vineyard, and just the setting is a lot more relaxed on the island. It's such a beautiful island. It's a beautiful hospital. It's pretty new, but they do still see a lot of patients, especially in the summer. So in the summer, it didn't feel that different being in the hospital, but once it hit the winter, it definitely slowed down. It was an older population that I saw. And if the weather was bad, they sometimes couldn't ship patients off the island. So luckily that didn't happen to any of my patients, but it was a possibility. So yeah, definitely different working somewhere with limited resources.
Totally. And you have to get very, builds your skills up, I think, a lot as a clinician as well, and as a nurse. So you have to really
Mhm.
rely on everything that you know. So that's just a really unique experience that I think not everyone gets to have. So thank you for sharing.
Yeah, yeah, it was an experience I really enjoyed. So I'm glad I worked there.
When did you decide that it was time to pivot to more of a APRN role, what changed and why did you decide to pursue higher education?
Yeah, I always thought about being a nurse practitioner, even in high school when I was applying to nursing schools. But I knew I wanted to work a little bit as a nurse for a few years just to gain some experience and make sure it's something I really wanted to do. So I started really thinking about it after 3 or 4 years being a nurse and then applied to schools. I went back after 6 or 7 years. And I think that was a perfect time because then my program was 3 years. So by the time I graduated, I already had about 9 years of experience being a nurse.
Yeah. And that is something to consider. Like, did you always, I, I actually like did not even know that NP was a thing, really, being a nurse practitioner, especially in college. Like, I don't know why that wasn't on my radar. So kudos to you for like having that on your radar, that that's kind of something you wanted to explore. Was Did you decide, how did you decide to go family? Was it mostly just because you had a well-rounded background, or were you considering other options for tracks?
Yeah, I think just because I knew I liked working in pediatrics before I was full-time pediatrics, I did a per diem job when I was also working labor and delivery, so I got a little taste of it, and I did really like that and also women's health. So just to not only give myself the option for women's, I did family. And I really enjoyed the program and having clinicals in both settings. So yeah, it was a great experience.
What did you think about going a part-time? Because you went part-time, right? So how was your
Yeah.
experience in going part-time? Um, did you think it was like really nice to have the years of schooling as part-time to kind of transition? Did you find that you were like just ready to graduate? Can you speak a little bit about your experience as a part-time student?
Yeah, so my program was part-time for 3 years. It was right when COVID started. So some of my classes started in person, and then by the end of my program, everything was virtual. Um, I did really like part-time because I liked working while I was also going to school because I could apply a lot of the things that I learned at work at clinical and then also clinical at work. So I really enjoyed it. I know some people like prefer full time, but for me, I just enjoyed the experience of doing both. Yeah.
And how, so right now you're working in postpartum. So you're in a
Mhm.
hospital setting doing postpartum rounds. And I'm probably safe to say that your clinical experiences were probably nothing like that. How did you transition into becoming a postpartum NP? And how did you even like find out about becoming a postpartum NP?
Yeah, I think just when I was applying to jobs at first, I would see some postings at different offices that I work at now for rounding, and I thought it would be interesting. Um, but yeah, like you said, none of my clinicals really were inpatient at all. They were all outpatient since it was a family NP program. But my background in labor and delivery really helped my current job because I really got a good basis of learning complications of postpartum and what happens on L&D before they get to my floor. So I think working L&D definitely helped what I'm doing. And then everything else, I feel like I've really learned on the job.
Yeah, let's talk about the job transition a little bit. So my only experience is in outpatient settings, and what I know of inpatient is just what we see as nurses. How do you think Can you tell us a little bit about your transition? How much time you had to transition? How much orientation time you had? And kind of how long it took to feel comfortable in the role?
Yeah, so I took a little bit of time off after school. I got married and had a baby, so it delayed starting the actual job. But once I started, it was last fall. I worked at the office at this private OB/GYN office previously as a nurse. I called them before I was a nurse there and just asked if they were hiring. I looked around at different positions prior and um, kind of like my clinical experiences, I just cold called offices. And I called my current office and asked if they were hiring. And my manager said that they're actually looking for a postpartum rounding NP. So I started being a nurse first, and then I transitioned to the NP role after I had the baby. And then my orientation as a rounding NP was about a month, which is on the longer side for rounding.
Hmm.
Usually, I would say since it's such a niche position, um, it's usually only a few days to a few weeks. So a month was on the longer side. And I followed one NP, and then by the end of the month, I was basically seeing patients on my own.
Wow. So, do you feel that if maybe somebody listening that is a new graduate or new to the NP or postpartum or that niche field, do you think a month is a good amount of time to ask for orientation, or do you think it's like dependent on the acuity and patient population, or how much time would you say that you would suggest?
Yeah, for the role of just postpartum rounding, I don't currently see patients in the office at my OBGYN office that I work at. So I'm just rounding inpatient as a nurse
Mhm.
practitioner. I feel like a month was perfect.
Nice, nice. And then
Mhm.
I'm assuming that, so walk us through what that looks like to be a rounding NP. So is it just that you round on like the entire floor, or are you assigned a certain amount of patients a day that you have to see?
Yeah, so I see only the patients that go to my practice, and I go into the
Mm,
hospital. I get there about at 7:15, and I look up all my patients for the morning. They could either be staying a few days or going home that day. So I look into their chart and see how long they've been there for. I look up their whole history, and usually I see about 10 to 15 patients depending on the day. And I see the discharges first and then the patients who are going to be there all day afterwards. Um, yeah, so I take a little bit of time, just go over all their lab work, make sure they got all the medication they needed before discharge, and any
mm,
complications I look at, vital signs, lab work, like I said. And then I see patients probably takes me about 45 minutes to look patients up, 45 minutes to an hour. And then I go see them, and it probably takes me a few hours.
wow. I'm
Mhm.
assuming you're doing quite a bit of teaching actually in this role. And I mean, new moms, there's new parents, there's
Mhm.
family members. I would imagine that like teaching is quite a bit of your role as well. Just
Yes,
what to expect
definitely.
postpartum, what's normal, what are normal precautions to have, when to call back.
Yep. I think that's why it takes me a few hours to round. I feel like other rounding positions, people go through their patients pretty quickly, but I do spend a lot of time on education, what to look out for when they go home. Often the patients have a lot of questions about what to expect,
Yeah.
even about the baby. So yeah, it's definitely a lot of teaching, and the most teaching I would say is the patients being discharged. Yeah.
Mm. And how it's kind of unique because you actually recently just went through birth and becoming a mother.
Mhm.
And how was that? I mean, to me, that's a hard transition. How did you find that transition, becoming a new mom, starting a new job?
Mhm.
Tell us a little bit about your experience with that.
Yeah, I think just coming back from maternity leave, it was hard, and it was a transition. Um, but I think the amount of days I'm doing, around 3 days a week, has been perfect for coming back from having a baby. The nurse practitioner I was with also recently had a baby, so I feel like she was kind of a mentor and just helped guide me with the transition. And I think also being a nurse in the practice that I round for was helpful because I already
Mm,
knew all the doctors. I knew this charting system we use. I know the protocols. So I think that was a good transition being a nurse first, which some nurse practitioners prefer not to do that, but I did think it was helpful for my experience.
yeah, totally. And that's so great that you have such good mentors within your organization. Just curious, is it primarily mostly APRNs that are rounding and then you guys haven't the hospital attending, or what's the setup? Are you like one of a few NPs? I'm just kind of curious on that.
Yeah, so for my practice, we have one nurse practitioner rounding in the morning every day. But I know some practices have the doctor rounding, and then on the weekends have a nurse practitioner rounding.
Mhm.
But since my practice is pretty big, the L&D attending kind of stays on that floor, and only if something emergent happens, they would come on to postpartum. So NPs round for our practice 7 days a week.
Wow, that's great. That's
Mhm.
great. And I'm happy that you found something that's a little bit flexible, which is really important. It's you need flexibility, especially as a new mom and just in
Mhm.
general as an NP. It's everyone wants a flexible job as much as possible. So,
Yeah, yeah.
can you speak a little bit to the types of complications or patients that you might be managing as a postpartum nurse practitioner?
Yeah, so it is a niche field, but I feel like sometimes I do see different complications. depending on the day. But the most things I see is high blood pressure. A lot of my patients, just where my practice is located, is the patients are on the older side. For having a baby, they're in their 30s. We have some patients in their 40s. The area is very highly educated. We have a lot of patients who get their master's degrees and then have kids after. So just based on that, we have a lot of advanced maternal age, which you see high blood pressure with.
Yeah.
We see infections, patients who had choreo during labor and delivery, some surgical site infections, which only ever so often we see. Trying to think. We see a lot of urinary issues after having an epidural, some people with retention, and complications from blood loss. Sometimes we see high blood losses, 2 or 3 liters from the delivery. So getting blood transfusions, patients fainting, things like that we see.
Got you. So it really is like a lot more than you would ever imagine. I mean, there's hematological conditions, there's endocrine conditions, there's gynecological conditions, surgical site infections. Yeah, it's definitely very unique, which is really great.
Yeah,
So
yes, definitely.
I'd like to pivot a little bit because I think part of today is what we also want to cover is prepping for interviews, because that is something that we see a lot of new grad NPs maybe struggling with, or not even struggling, just being nervous about. And so I thought you'd be the perfect person to kind of chat about interviewing with. So I'd like to just kind of have a conversation about what you thought was helpful for yourself, or maybe some other people that you've mentored going through the process about applying for new jobs as a new grad, and kind of what your personal experience was like as far as when you do interview. Do we prepare clinical? Do we not prepare clinical questions? Yeah, so I was hoping you might share a little bit about that.
Yeah, so before I got my current job, I did go on a few different interviews, some women's health, some pediatrics, because I wasn't sure exactly what I was going to go into at first. And I did have a lot of different experiences. I've had some interviews with a lot of clinical questions. Some, I would say most of them did not. A lot of them had behavioral more questions. Questions like, how do you deal with conflict? What would you do if you disagree with another provider? What would a patient explain your personality to someone else about you, or how would your coworkers describe you? A lot of questions like that. So before an interview, I would say find out who you're interviewing with. Sometimes I just say, oh, this is the time you're interviewing, we'll see you then. But I would always ask who exactly I'm interviewing with, because it's really helpful to know if it's going to be a few people or a whole panel. And then I would look up whoever's interviewing me, look up their background, see if I have anything in common with them that I know we could talk about. And then also look into where you're interviewing, the history of the practice, just so you're knowledgeable of where you're actually interviewing. And then I would go through your own history, look at your own resume, and just jog your memory of every job you've had, to see if you can talk about it during the interview, and then also study the behavioral questions.
I feel like it's always so interesting to hear everyone else's interview experiences, especially all over the country, because I do think they kind of differ a little bit. And
yeah, I'm sure they do.
Yeah.
Yes.
And as far as the clinical, so that's really great that you've mentioned reviewing your own resume, because we sometimes forget that we've lived the experience, so we feel that we could articulate what happened very well. But sometimes it's nice to just review, okay, let me review leadership roles that I had during that time. Let me review what my clinical skills were. How could it relate to this job moving forward? Or is this a very unique point that maybe would advance me as a candidate compared to somebody else? So I think that's a great pearl that I would say I don't always do. So I think that that's really unique to say. As far as clinical questions go, what type of clinical questions have you encountered when you have interviewed, or heard other people maybe encounter?
I would say I've had scenarios just about how would you, if you had a patient come in with this, what are the first things you would do, and what would their workup be? For our women's health, I've had if someone comes in with irregular periods, what's the first thing you would do? And then for pediatrics, I've had if a patient came in and their growth was lagging, what's the first thing you would look into? I would say questions like that, which are hard to study for sometimes.
Yeah.
So it is good to practice just looking through material. If you're doing a pediatric job, breeze through your pediatric book or women's health, just review a few things before.
Yeah, good point. And a lot of it is more like probably they're clinical questions, but they're more targeted to see who you are as a provider, how you critically think,
Yes.
and what's your
Yep.
processes for doing that. So a lot of it is
Yep.
probably things that we have experience in as an NP school, but it is good to really prepare that, because sometimes people get caught off guard by some of those clinical questions, or they really panic about them.
Yep.
And not really like take a deep breath and just know that you know this information, you pass your boards, and
Mm-hmm.
just speak as to how you would act as a provider.
Yeah, yep. I think they can definitely be tricky sometimes, especially if you're a new grad and haven't been a provider yet.
Yeah, or don't have experience in that field either. So
Yes.
if you're an
Yep.
FNP without a lot of OB-GYN background per se, and maybe you didn't get as much rotations, I mean, you should be able to answer those questions, but it would be good to like brush up on some material probably before you interview then. For sure. Or
Yes.
talk to somebody else in that role. So talk to maybe another MP that you know that's in that type of setting, and maybe pick their brain about what types of clinical questions they ask at their practice when they're hiring new providers. So that might be helpful as well.
Yeah, yep. And I've also had siblings not in the healthcare field, but they've had a lot of uh, interviews being just out of college, and they've been using AI to help prepare for interviews, which I find is really smart. One of my
Yeah.
brothers asked one of the AI websites to come up with practice questions for specific interviews, and he found it really helpful. So I think that's really cool to bring
Well,
to a
neat.
new
I
job.
think that would be, did he find that it was very like applicable to what the interview was like? Did he feel like it was?
Yep. Yeah, he found it was very helpful. And he's like, I don't know if I would have gotten this job if I didn't prepare adequately from this.
Wow. And every
Mhm.
field is so different too. So some like do
Yeah.
presentations. So maybe that's something that I can put like a sheet together later on as a resource for our new grads that might be helpful.
Hmm.
So that's a great tip. As far
Yeah.
as the
Yep.
behavioral questions go, people forget to practice behavioral questions. So I think a lot of, you kind of mentioned how would you handle conflict as a
Hmm.
common question. Um, what are, have you ever had to take like any personality tests or like those long exams about, I don't know, I had to take that like once or twice about how would you respond to situations if you're under stress? Like I had to take like a questionnaire type based interview. Have you ever had to do that during the
I
interview
don't,
process?
yeah, I don't think I have. I've definitely heard different fields doing that, but just with my prior interviews, I haven't.
Hmm. How do you prepare for some of those behavioral questions? Are you making a list and practicing them through? Are you, if you hear a good question, I'm sure during one interview or from somebody else, you're adding that to your list. What are some tips that you might have to kind of like practice those questions? Do you actually practice with someone, or do you practice in front of a mirror? What do you do?
Yeah. If I haven't done an interview in a while, then I typically would ask I've asked my siblings to help me in the past. So I've had my siblings ask, oh, can you just ask a few questions? This is what I'm interviewing for. What do you think they could possibly ask me? So I find that helpful. And also I make a list of things about myself, things that I can work on, because a lot of interviews have asked that. Um, so I've made a list of that and things I'm great at, and just to have them prepared in
Yeah.
case they ask me.
I think that one topic that especially new grads when they're applying for jobs, they struggle to navigate the question of, you are a new graduate provider, why should we hire you basically over someone that could have more experience or maybe has more
Mhm.
experience. What is some tips that you might have for a new grad that's maybe navigating that question and really struggling with that question?
Yeah, I think at that point, try to bring your nursing experience in. I think it is tricky if you're going through a nurse practitioner program that goes right through. You're a nurse and
Yeah.
go right through a nurse practitioner. So I don't really have experience with that, but being a nurse for 12 years now, had a lot of different patient experiences, and I feel like I always bring that into different interviews.
Yeah, so highlight our experience always. Nursing,
Yes.
yes, it may not be in the NP field, but you
Yeah.
have that experience, you have that patient
Yep.
experience to speak
Yes.
to. Just,
Exactly.
is there any other tips that come to mind? Well, one thing I wanted to kind of chat about too is that I think you told me that you mentioned that you cold called to get your NP job.
Yes.
Um,
Yep.
are you finding that that's like a common theme for other cohorts, members in your cohort, how they found their jobs? Is it mostly through like their clinical rotations that they're finding jobs? Are they
Mm-hmm.
applying just directly online? Like, have you noticed any new trends?
Yeah, so I got that idea from actually one of my old coworkers who's a nurse practitioner. She cold called a pediatric office, and that's how she got her first job. So she really encouraged me to do that. And I was also already doing that for clinical placements because my school didn't help me find clinical placements at the time. Um,
Yeah.
so I was kind of used to calling offices, and I just started calling women's health offices and asked if they were hiring. So yeah, I think it's definitely helpful for private offices. I know for bigger ones, like big hospital chains like Mass General Brigham, you have to go to their website and
Hmm.
apply there. So I feel like it's only really more helpful for private offices.
Got you.
Mhm.
When did you start when would you recommend start applying for jobs? I know you had a very unique situation because you had a baby, but if in a perfect world, do you think new grads should start applying kind of during their last trimester semester that they have? Should they wait till after their boards? That's another common question that people kind of ask.
Yeah, I think it kind of depends where in the country you are and how soon you want to start.
Mm,
I live in the Northeast Boston area where it is competitive. There's a lot of nurse practitioners in the area. So I would definitely suggest starting sooner. I would say a few months before you graduate. Because if you do get a job, then you'll be graduating soon and you can line it up right away. But I know in other parts of the country, like rural areas, they really need NPs, and I'm sure they would have someone start right away. So if you are looking to work right after graduation, look before graduation or around that time. I know some friends of mine have taken 6 months off, but I guess that is something you could always talk to your employer about if you do end up applying and getting a job and just start a few months later. So yeah, I
yeah.
would definitely suggest starting as soon as you can.
And then credentialing too. So if you are
Mm-hmm.
thinking about another state, I think that it's important to apply for your RN license first in that state to just make the process a little bit smoother. By the time you get your certification, then you're not applying for both RN and APRN. You're kind of just applying for one, which I do think that probably helps expedite things a little bit.
Yes. Yeah. And with different
Process.
insurances in the office, if you're working in an outpatient setting, it takes a few months. And also inpatient, it took me a few months to get my credentialing for inpatient.
Yeah. Yeah. It can be a lot. As far
Yep.
as like usually there's like a phone interviews first, usually from HR. They're going to ask. I've had some experiences where they ask some quick behavioral questions as well on those interviews. When I'm just kind of curious because you kind of had that COVID transition from online to in person. Do you find most of your interviews now are mostly in person, or are you having a round on Zoom or with telehealth and then coming in person afterwards?
So before my current job, when I was interviewing, I would say a lot of the first ones were phone calls.
Mm,
And then I would say 50-50, then having the next interview uh, on like virtually versus in person.
hmm
So
hmm
I think still a lot of them are virtual, just from COVID.
Yeah, I think I'm noticing that trend too from other
Yeah,
people as well. So it's just something
yeah,
to think about, which is kind of nice, especially if you're applying from far away. You're not necessarily going to be expected to be there in person all the time.
yeah,
It is always good, I think, to do a site visit, especially if you're super interested in the job. It's
yeah,
always good to meet your employers, understand your coworkers, just see the environment you're going to be working in. So,
yeah, definitely.
how so I think we've covered quite a bit about
Mm.
the transition into practice and interviewing and tips. I wanted to touch base on your resume real quick because that is
Mhm.
something that I think oftentimes we overlook, or now with AI, it's obviously changed quite a bit. There's a lot more resources out there. How did you prep your resume to reflect the fact that you've had so much nursing experience, and you kind of have to, you can't have a resume that's a CV that's 6 or 7 pages long. How did
Yeah.
you navigate having such amazing nursing experience and then also your practicum experience and then applying for NP jobs? Do you have just one resume that's kind of tailored? Do you change it up when you were applying for like a peds job versus a OB-GYN job, or not really? You just had one?
I think I change it. I've changed it in the past a little bit because I've had pediatric certifications and also OB certifications. So
Oh.
sometimes I'll change those depending on the job, or like I'll add one and take one out.
Mm-hmm.
But I'd say most of the time I keep the same one. And actually, in college, I went to, I believe it was career services, and they helped me with my original resume. So if you're still in undergrad, or even I guess graduate
Grad
school, you can
students,
go to
yeah.
your school and your school can help you edit your resume. Because I think it's really helpful to have another set of eyes looking at it, because they would pick things out that you wouldn't, and just visually help it look clearer and more succinct. So I try to make my bullet points pretty clear and just easy to read.
Yeah. Do you bring your resumes with you or your CV with you when you interview, like when you interviewed in the past,
Yeah.
or
Yep.
oh, you brought it?
I I do. Yep. I've had employers ask for my resume during the interview. So I definitely bring a few copies. If you know
Mm-hmm.
you're going to be interviewing with a lot of people, bring enough for every person just in case.
And you'd only know that if you ask. So Colleen always asks, how many people am I going to be
Yep.
interviewing with? Who am I going to be interviewing with? So you can really know who that is. Are they all within
Mhm.
the same department? Are they not? In your experience, have you, like, do you interview with a lot of people? Is it like a round robin where they're asking you questions, or has the interviews been more about you asking them questions?
I've had both. I've had some interviews where the employer is talking most of the time and they ask if I have any questions at the end. But I've had some interviews where I'm leading the interview and they asked me to ask questions. So I would definitely have a list of questions for them prepared. That's probably the one of the biggest things I prepare ahead of time. I have
Mm.
questions, yeah, already made up. And if a lot of places have you interview with HR, or doctors or other nurse practitioners. So have different types of questions prepared for each type of person.
Yeah, that's a great thing, because a lot of the clinicians are not going to want to answer, am I going to get compensated for my on call time? Am I,
Yes.
they're not there to answer those numbers questions as much. They're there
Yeah.
for to understand what the clinical role is supposed to be, kind of what their experience is, and for them to really understand how you might handle like challenging or tough patients. So that's a great piece of advice, which is
Yeah.
wonderful. So I'd like to close out today with a fun little kind of quick would you rather session. So
Yeah.
Colleen and I were really lucky. We got to study abroad when we were undergrads, and we both studied abroad in Australia, which is very unique at the time back when we went to undergrad. And there was
Hmm.
very few nursing schools that actually allowed you to study abroad. So that was just a really fun time. So I just have a couple of little closing questions if you're up for it.
Yeah. Yeah, definitely. I'm always open for talking about Australia.
Okay, wonderful. So, and some of these might be Italian questions too. I don't know. I can't
Ooh,
remember. So, would you rather eat an Oreo versus a Tim Tam?
I would say Oreo. Tim Tams are pretty great, but I do like the American Oreos.
Oh, I wasn't expecting you to say that. Okay.
Yeah,
Would you
yeah.
want to have a cortado versus a flat white?
I would say cortado. Australia definitely is known for their coffees, especially Melbourne. It's they have some of the best coffee in the world, and so I feel like I've tried quite a few there. And yeah, I like less milk in my coffee, so I would say cortado.
Okay. Unlimited PTO versus hourly pay.
That's tricky. I've never had unlimited PTO, so
I
I'm
know.
leaning towards that, especially because we both like traveling, so we would definitely appreciate that. But in general, I do prefer hourly pay if I had the choice between that and salary.
Mhm.
But with this ultimatum, I would say unlimited PTO.
In your area, just a quick question about that. Do you see a lot of hourly positions, or are they mostly salary for NPs?
I would say 50-50.
Mm.
Um, yeah, a lot are salary, but I guess a lot are hourly too. Sometimes it's hard to say those because you may not know that information until you really get towards the end of the interviews or
Yeah.
closer to getting offered the job. Yeah, so I've definitely seen both.
Gotcha, gotcha. And they are very different. And no, unlimited PTO, I don't even think exists for healthcare. I don't know where
Yeah,
that
yep,
exists, but count me in one day if that
yeah,
exists. They would
yep,
have no clinicians working probably.
yeah, yeah.
Cadbury versus Hershey.
100% Cadbury,
Mm. We
especially
actually,
from Australia.
yeah. Was it, but the factory is in New Zealand, right?
Yeah, I think they do have some in Australia,
Okay.
but it's definitely better ingredients than the Cadbury in America.
Oh,
It
we have a
definitely tastes
Cadbury
different.
American version?
Yeah, they sell it here. It's just different manufacturers and
And
different,
different
I'm sure
ingredients,
it's different ingredients.
of course. Okay, Gold Coast versus Cape Cod.
I've never been to the Gold Coast, but I feel like I've been to other
Other
areas
areas,
of
yeah.
Australia besides Gold Coast. I'd probably choose there just from the pictures that I've seen.
Mm.
But I do like Cape Cod too. We both are Cape Cod people.
Cape Cod people. And then childcare in the US versus childcare in Australia.
As a childcare in Australia, I've heard the government helps you based on your salary with childcare. So daycare, the payments are according to how much you make, whereas here it's definitely not like that. Um, yeah,
Yeah. Yeah. Well,
I would
thanks
say
for
Australia.
all those little tidbits, Colleen, and us getting
Yeah,
to know you more.
yeah.
Is there any other thoughts that you have, or any other pearls that you want to share with any new grads that are thinking about going through their interview process that you think could be helpful?
Yeah, I would just say prepare as much as you can before the interview. That way, when you're going into it, you're more confident.
Mm.
You feel like you know what you're talking about. And even starting a new grad job, the night before you go into the office or the hospital, just prepare as much as you can. If it's looking up patients, looking up their history, or just clinical scenarios that could happen, I feel like that's been really helpful for me. I either try to look up my patients I'm gonna see the next day, and if I'm able to do that, then I'll look up their medical history and the different um, comorbidities they have. So if I'm not familiar with it, I look it up beforehand.
Yeah, great advice. And hopefully, other NPs find this very helpful. So, thanks again for joining, Colleen.
Yeah,
And
thanks for having me.
yeah, of course. And is there anywhere that we'll leave if you want to get in touch with Colleen ever, or you want to send her an email? We'll try to provide that as well in the show notes.
Mhm.
Okay. Thanks, Colleen.
Thanks.
Join us next time
Bye.
on the Thriving NP.